Yep, we are now live on Facebook and on YouTube. I need to press one more button to be live on Facebook. We are live on YouTube. Good morning, everyone. And I'm just waiting for the confirmation here for my screen. We are live on Facebook. Beautiful. Great. I'll go ahead and stop sharing this screen and get us going. Good morning, everyone. Debbie, are you ready? Good to go? Let's do this.
Yeah.
I'm Clayton Cheever. I'm the Assistant Director at the Thomas Crane Public Library, and I'm really grateful that you all are joining us this morning. We are having another program today. This is the third in a series of falls prevention and stress management for aging adults, and those of us who care for aging adults, or those of us who hopefully will all be aging adults as we continue. So everybody can get something from this today. I'm super grateful to Debbie Toomey for doing this today, and just so thankful that she can come and share some time with us so we can all learn how we can be healthier. So thank you for taking care of yourself, for taking care of each other, and for joining us as well. There's a lot happening at the library. I always like to give a little plug because I have you for a moment. I hope you will come back this evening where we have a really fun program tonight with the Quincy Historical Society, where we're looking at a Quincy legacy that impacted the entire country. We're going to be looking at the history of Howard Johnson's as shown through their advertising. So we're going to be sharing, we've got probably the largest collection of advertising and paraphernalia from the Howard Johnson's empire, because it was given to the Quincy Historical Society because Howard Johnson, was right here in Quincy, and this is where it all began. So if you're interested, if that's something you have fond memories of, or maybe it's something you don't even know that much about because you missed it somehow, that's all totally fine. It's going to be really fun. They've got a bunch of print ads. They've got some television ads that have not been seen very much at all from their treasure trove. It's going to be a really fun event that's happening tonight at 7 o'clock. You can find the link on our calendar, which is on our website at thomascranelibrary.org. There's lots more happening. We've got cooking classes coming up. We had a great program last night with the Ultimate Red Sox Time Machine. You can go and watch that recording on YouTube and Facebook if you'd like to go see it. There's just lots happening here. So I'd love to see you again soon. Thank you for joining us, and I hope you have a great morning. Debbie, I'm going to pass the mic over to you. Good morning.
Good morning, Clayton. Good morning, everybody. Thank you so much for being here. Today, as Clayton had mentioned, is the third session of the Falls Prevention and Stress Management program for the aging adults. And I want to, the background looks a little different. This is my actual office at Tufts Medical Center. And you'll see behind me I'm not going away on vacation. That's big luggages there filled with mannequins. Besides doing programs for the aging population on falls prevention, I also do Stop the Bleed program, which is it's an initiative that came about because of the Sandy Hook shooting. So I've been really lucky about doing programs, offering that type of program, the Stop the Bleed program for Boy Scouts, people at church, hospitals, different locations, MRCs, MassDOT. So that's that's the luggage back there. I will begin today by saying thank you to Quincy Public Library for sponsoring this program. I really appreciate that. It makes my work that much easier to bring the word out about being more mindful and being more present in the moment so that people are less likely to have unintentional injuries, which could end you into the hospital, places where you kind of don't really want to go unless you have to. So I really appreciate the Quincy Public Library for sponsoring this. So I just want to do a quick recap, and then I'll do a slide share. And then after the slide share, we will do some skills, the skills portion of the program, where I will be going over some of the mindfulness skills, techniques that we went over last week. And also I want to introduce another one. Why is that important? Because I feel, especially during the climate, the history, the times that we're living in, the more skills we have in our back pocket to help us feel more calm, at peace, and in control, the better for us, the better for our health, and well-being, and the less likely that we will end up once again with unintentional injuries. So the first week I started, I talked about falls prevention, because Falls Prevention Awareness Week falls on the same week as the week of fall, the autumn season. And that is the time when we all, people in my industry and also the National Council of Aging, we all really gather and think about ways to promote and to remind people to be careful in their home and also outside their home, to make sure that they don't slip, trip, fall, and also to be more active so that when they are at home or outside their home, they're more fully engaged in their body. They're more attentive to what they're doing, and they have the strength, flexibility, coordination, and balance to do it. So that's what I covered, and I'll do one or two of those exercises in a few seconds, just so that way for those who missed the first session, they'll be able to see what we did. And then last week I talked about the importance of mindfulness, and also we talked about stress reduction. I introduced mindfulness, and that's when we did some breathing exercises as well. And mindfulness is a way to help us not empty our mind, but really to notice the thoughts and the feelings that is impacting, that's going on in our mind and our body. So that way we're able to kind of check in with ourselves and be able to make healthier choices, so that we're better able to respond instead of react so quickly. And we'll be doing some exercises with that later on. Today is more about learning communication skills that build confidence and talking with the medical specialist. And I am so excited because this month, October, has so many awareness days and weeks to it, and one of that is health literacy, and I'll show you my slides in a few seconds and then go over another awareness. So before I get started, I like to start all my workshop with a little bit of a warm-up exercise, so that way I and also my participants are fully present and be able to really turn on their brain cells, muscles, and also be able to kind of just be comfortable where they are sitting. So I like to take some nice deep breaths in through the nose. If everybody can join me, breathing in through the nose and out through the mouth, in through the nose and out through the mouth. Again, slowly in through the nose. Hold it if you can, and then breathing out through the mouth. And let's repeat that again, breathing in and breathing out. And just to kind of get some of the wiggles out of our body, can you tell I do workshops? I also do workshops for children. So, you know, we all kind of get a little bit wiggly and kind of restless sitting on the seat and wondering what's going to happen in the next, you know, in this program. So just to kind of get some of the wiggles out, let's do some sitting cross crawl. So you're using your hands, your right hand tapping on the left knee, and then the left hand tapping on the right knee. So we're just alternating our movements wherever you are. This is great for brain function. It's great for coordination. It's great for balance. And for those of you who can stand, I'm not sure how steady you are on your feet. If you're not too steady on your feet, please do this, stay sitting down. But if you're able to stand up and kind of do the cross crawl, or if you can't do that, you can just kind of march in place. That's fine too. So just nice and slowly, easy. We're getting our body warmed up. We're letting our right side of the body and the left side of the body kind of communicate with each other. So that way our body is in unison. And as we are doing this for our body, we're challenging our brain as well, because our brain's trying to say, is thinking, okay, right and left, right and left, trying to coordinate everybody. Just letting people in. So here we go. So keep going. Let's do that for another 10 more seconds. I got my wall clock here in my office. And as you're doing this, remember to breathe. All right, so that's good. I feel better. I'm not sure about you, but I feel much better. I feel more awake. All right, so please look for your seat and slowly sit down. All right, so I'm going to start the screen share. All right, and please give me, Eileen, can you give me a thumbs up to if you can see my screen? Yeah.
You're looking good, Debbie. Yeah.
Okay, good. All right, I just wanted to make sure. All right. All right, so once again, this is, it's October 6th.
Yeah. I'm a bag nigga, fuck me in a Tesla. Nigga rubbing on my thighs with some ketchup. Yeah, so you know that. I got dildos, I got lube, what you want, son? My dick small, you act like you ain't noticed. Oh my God, dude. Put my dick inside his mouth, he started choking.
Thank you. All right.
And my sister with that hoe shit, I'm twerking.
Okay. All right. Sorry about that.
Sorry for that. Why don't we go ahead and we'll make it so that you can control the mic, Debbie.
All right.
Also, a couple folks that I think we're doing that, I just bounced out of this, so we shouldn't be interrupted by them again.
Great. Thank you, Clayton. All right. So again, this is week 3. And just as in the prior weeks, whatever information, exercises, tips, or tricks that I share with you, always check with your doctor. It's in no means supposed to replace whatever plans or medical treatments that you have with your doctor. Always consult with your doctor to see if any information, any exercises are beneficial for you. All right, here's my pumpkin. Happy October, everybody. I can't believe here we are, October. All right, so I mentioned earlier Health Literacy Month. There's a lot of awareness going on every month, and in October, there's a lot. In the beginning of the month is the Health Literacy Month, which actually is perfect because of the topic I'm covering today, which is effective communication skills when you are in front of your doctor specialist. So Health Literacy Month, for those of you who may not know what it is, it's a way for organizations and individuals to try to find a way to make health information be more easier to understand. Okay, so I know working as a nurse in the hospitals, you know, we have so many medical jargons, and in the pharmaceutical industry, new medications are coming in, and the names are getting longer. Everything, the new diagnoses are coming in. That's hard to pronounce sometimes. It makes it really hard. It makes it really hard to understand what is truly going on in basic terms. And so Health Literacy Month is basically a way for healthcare professionals, the healthcare system, to understand that not everybody speaks our language. And also, at the same time, it's a time to remind the public also to take the time to take that extra time to educate yourself on the latest medical conditions or your own health and your own medical conditions and your medications, because the more you know what your body, how your body is, and also the type of medications, if you have any, or medical conditions, if you have any. The more you are in tune and informed about what you have, the better it will be for you to ask the right questions when you are with your doctors. And the importance of that, besides knowing the right questions to ask and also what's going in and out of your body, they have found that people who don't quite understand what's going on with their body, or they may not have the literacy for the knowledge of health, they tend to not ask the right questions. They tend to not stick to their medical plans. They tend to end up in the ER more frequently. They tend to get more sick, basically. So, you know, as healthcare professionals, we do our best to take care of you, but it's a partnership. We need you to also take the best care of yourself, so that way you can live a healthier and longer and happier life. So Health Literacy Month helps to break down the barriers that keep the average person from understanding his or her medical condition, talking with his or her healthcare specialist, and sticking with his or her medical plans or treatments. So in a nutshell, in alignment with the whole idea behind health literacy, I'll keep it simple. It's a reminder for healthcare professionals to be mindful of medical jargons and to make sure that our patients understand what we're talking about. And also to make sure that we take the time to have the patients ask the questions, and also make sure that they leave our interaction, our appointments, our sessions with them in a positive way. So that way we know that the patients really understand what is going on with them. And at the same time, that's the role of the healthcare professionals. The role of the public is, or the patient is, to take the time to ask the questions. When you are there to see your doctor or to talk with a nurse, ask your questions. Stick up for yourself. Some people have taken care of a lot of patients, thousands of patients. I've been a nurse for over 30 years. And some patients, they have this white coat syndrome, and they just kind of forget what they're going to ask the doctor. And they just do like, yes. And the doctor or the nurse would ask, so do you understand what we just went over? And they're just nodding because they either forgot what to ask, or they don't think they have the right to ask. So please advocate for yourself. And also another aspect is, again, adding knowledge. Be a self and a lifelong learner. Learn about your body, learn about your medical conditions, learn about different medical conditions, learn about ways to keep yourself healthy, learn about your medications. So being a lifelong learner is so important, no matter how old we are. It's just information is changing every day. And we can see that happening right now with COVID. Every day, almost every day, there's new things to learn, there's new adjustment to be had, and there's new things that we need to really be on top of. So that's important for our health. All right, so here we are, just a little, again, to emphasize health literacy. It's all about, it's almost like a team sport, I like to say. It's you, your family members, and your caregivers all working together with your specialist, making sure everybody understands what they're supposed to do. So that way you have this winning team. Okay, some barriers, some factors that keeps the literacy, health literacy from happening for some people, not for everybody. Okay, again, it's just depending on who you are. Your educational level has a lot to do with your ability to read and write. Language barriers, okay? Your hearing, your ability to hear, your ability to see. So my mother wears 2 hearing aids, and She is in her mid-80s. I like to go with her when she has her doctor's appointment. While she is, she has her concerns, she knows what to ask the doctor. Sometimes the information transfer between the doctor and my mother, sometimes she's not able to hear. And people who don't wear hearing aids are not too savvy with that, because my mother has hearing aids. I make sure when I'm talking with somebody, especially if I see a hearing aid there, that they see my face, and I use my body gestures, and I try to pause and speak louder. Okay. Not to insult them, but just so that they understand and that they know that I am trying to convey a message. People with visual problems, the same thing. If we as healthcare providers give our patients information that's just so teeny that even reading glasses can't capture it, or if we give you information that is just so long and convoluted that it takes half a page to spell out one word, that's not going to do anybody any good. So it's important for healthcare professionals to know who the patient is, their background, so that way we're able to convey the message for them in a respectful and appropriate way. And we pride ourselves in that at Tufts Medical Center. So educational level is a barrier, language is a barrier, hearing and vision. Also, people, as we get older, sometimes the memory kind of, it's not working as well. So forgetting things, that's also a factor. Stress level, also a factor. So I know when I'm really stressed, my ability to hear instructions or directions can be very limited because I narrowed down my focus. I become so hyper focused on something and I'm not able to retain other information. So stress level also is a barrier, a factor that can keep people from understanding fully what is being explained to them. I'm sure there are others, but I just want to cover the basic ones. All right, so again, people who struggle with health literacy, understanding their medical condition, the medical terminologies, the importance of the medical plan that they have in place for them, they tend to skip their medical tests, their treatments, their appointments. They skip it because they don't place any importance in it. And also sometimes they have a harder time living with their conditions because many different factors in that could be because of anger, denial, or they just don't understand that they have to have a certain type of diet in order to comply with their medical condition. An example would be diabetes. So if somebody is not too health literate about their diabetic condition and loves donuts, loves cookies, loves pies, loves ice cream, and they will just eat whatever they want, it's going to make their diabetes much worse. And for those of you who know people who have diabetes, or if you have diabetes, long chronic term conditions of diabetes is not really so good sometimes. All right, so also people who are health illiterate, don't have the literacy, they tend to go to the ER a lot more frequently. All right, so what can we do? What can we do about this? All right, so what can be done is bring a lot of different things. Bring your questions, come prepared, come prepared. You see, when it's sometimes it depends on the doctor. It could be difficult to make an appointment. It could be easy, but when you are with your nurse or your doctor, that's your time with that particular professional, and that professional wants to serve you the best that they can during that time, especially during that time, because they're with you face to face, or even, telehealth. But bring your questions, come prepared with your questions, because we don't read minds. We want to make sure that our time with you is as effective and as therapeutic as possible. So bring your questions, come prepared, so that way we're not wasting time trying to like ask you, so what else? So what else? Be there, ask your questions, advocate for yourself. Okay, if you have to, if you're going to be meeting up with new specialists, bring your medications, all your medications, even your supplements, because they want to see the medications that you're taking. Sometimes what's on your medication list may not be what's in your medication box. So bring your medications in the proper container that has the label on it. Don't bring the little pill box, because it's hard to identify the medications that way. If you bring your medications in the proper container, even your supplements, that's perfect. We love to see that, especially if you're meeting a new specialist. Again, that's less time taken away trying to figure out what are these medications, but more time talking with you about how effective are these medications? Are they working for you? Can you afford them? So all these different things we could ask you. Also bring your glasses, bring your hearing aid, pen and paper, things to jot down, because as you're asking your questions, guess what? There might be other questions that may come up because of the questions you just asked. So make sure you jot down your question if more questions come down, or jot down the instructions that the doctors are giving you and the nurses are giving you. Make sure you jot them down. And also try to, when you write down instructions or when you hear instructions, be sure to repeat them. Because when you repeat them, then the person you're repeating them to knows that you heard exactly what you are supposed to hear. And that's the time for the correction. So that in case you misunderstood something, then the nurse or doctor can give you the actual instruction. So that way you truly are leaving the appointment knowing exactly what to do. Of course, they'll give you a written information, but some people are visual learners, some people are auditory learners, some people are a little bit of both. Or so just like me, a little bit of both. So I want to hear it, I want to see it, I want to feel the paper too. So the more you could have reminders, the more ways that you could understand what's going on, the better. If you can, bring somebody with you. As I mentioned, I like to go with my mom and dad for their appointments, because I'm their eyes and their ears, and also their advocate. So if you could have a friend or a family member come with you, that's great. All right, so more things you could do for yourself. Reword the instructions like I mentioned, okay? And make decisions with your doctor that suits your needs and situation, okay? The doctor or nurse may not know exactly what your situation is currently, and it's important for them to know. If, for example, some people may have some financial problems or difficulties one month, or, you know, in the last few months, be sure to relay that information with your doctor or nurse. So that way they know that you may have difficulties trying to get from one appointment to the other, or affording medications, or affording clothing, food. The more you could share with them during that time, the better. Okay, ask any questions you have, and also make sure you know your medical treatment plans. All right, make sure you know who to call before you leave your appointments with them, and also what time the office is open, because some offices close earlier than others. What time are the weekend hours, off hours? You know, I'm sure you all know these, so I'm just reminding you of what you already know. So that way it's more in the forefront, okay? Again, be a lifelong learner, so important. Encourage people in your life to also be health literate. So that way they can understand also what's going on with them. And once again, speak for yourself, advocate for yourself. All right, so this is from the National Institute on Aging, and they really wanted, you know, something nice and really pertinent to share, and for their information to be shared by all. So it will capture what I just went over, okay? So 5 ways to make the most of your doctor visit. So talking with your doctor is important. Doctor or nurse practitioner or physician assistant, which is a PA, very important. Talk about your health conditions and also your concerns. Okay, number 1 is prepare for your visit. Be ready to ask 3 to 4 questions is what they recommend. Share your symptoms, what's going on with you, your medications, your vitamins, health habits, and major life changes. Anything drastic or traumatic that just happened lately. Very good for us to know. Okay, also take notes. Ask for written materials. Don't be afraid to ask your doctor to repeat or clarify information. Okay, make decisions with your doctor that meets your needs. We went over that earlier. Discuss risk, benefits, and cost of tests and treatments. Ask about other options and preventative things you can do. Okay, be sure you're getting the message. If you have trouble hearing, ask your doctor to face you when talking, to speak louder and more clearly. Okay, and also if you feel rushed, you know, the nurses and doctors, we try to work. It's hard for us to spend the amount of time, which is a lot, with our patients because we have other patients to see. So we value our time with you. So, you know, please, if you feel like there's still more that needs to be covered, just tell us, let us know, and just say, you know what, can you spend another 5 minutes with me, another 10 minutes? I want to make sure I understand the X, Y, and Z. So that way, you know, I can leave here knowing exactly what to do. And we would be more than happy to do that because, again, our role is to take care of you, and your role is to take care of yourself. And the best way that you can take care of yourself is knowing exactly what you're supposed to do once you leave the appointment. And for that to happen, we want to make sure that your answers, your questions are answered and you feel confident about the plan. All right, so that's with health literacy. As mentioned earlier, there's a lot of awareness weeks and days every month. At the beginning of October, besides health literacy and other awarenesses, there's also domestic violence awareness. Okay, so what is domestic violence? I'm sure you all know what it is. Sometimes it's called partner abuse. It's a pattern of coercive, controlling behavior that include physical, sexual, emotional, or financial abuse. And here are just some facts. There's a lot of facts, really sad facts. But here are just some. And I got this information from the National Coalition Against Domestic Violence. Approximately 20 people per minute are physically abused by an intimate partner in the United States. Okay, so IP, I just kind of abbreviated that. You know, 1 in 3 women and 1 in 3 men have experienced some form of physical violence by an intimate partner. Intimate partner abuse accounts for 15% of violent crimes in the US. Oh, that should be a big S. And forms of abuses, physical, mental, emotional, financial. Okay, those are just some. So what can we do? Well, if you are the one that is the person who's suffering from this, if you are the victim, that when you see your doctor, that is the time to let your doctor know. Okay, especially if you feel like you know that person, your partner, is always with you. Okay, we will be asking every time we see a patient, we see our patients, this is one of the questions we ask them. Do you feel safe at home? Is there any type of violence going on at home? And we ask with the person just there, not with anybody else, okay? So please let your doctor or nurse or physician assistant know if you are the victim of the abuse. Locally in Quincy, we are lucky we have DOVE, which is Domestic Violence Ended. And this month they have many wonderful awareness events every day. They're on Facebook as well. They have lots of different information. And let me see if I have, oh, here it is. I'm not sure if you could see that, Dub. Okay, so the numbers over here, there is a number for emotional support. And there's also a hotline that's open 24/7. 24/7 means 24 hours a day, 7 days a week. Okay, if for some reason all these numbers are way too hard to remember, dialing 911 is pretty standard for a lot of big emergencies. So that is also a number to call. All right, so that is with domestic violence. Again, for more information, I invite you to go on the Dove website to find out more. They have a lot of activities going on this month to bring awareness to this. This is a global problem, by the way. And sadly, it's not just adults, okay? It's also children who are suffering from it, either as the victim or witnesses of the violence. And think about all the type of trauma that they will experience growing up from that. And also not just adults, working adults, but also seniors also suffer from elder abuse. And that's going to be in another awareness month. But, you know, the whole gamut of our life spectrum, there's unfortunately abuse. So something to be mindful of and aware of. All right, so we're going to shift on over to the stress reduction skills. All right, last week I went over the 2-to-1 breathing exercise. I'm going to go through these slides a little bit quicker than the others because once I'm done with these slides, I will go off the slide share and you'll be able to see me doing the exercises. So that way we'll be able to do the exercises together. Okay. This is one of the, I like this part. I mean, I love all the parts, but it's a way for me to share with you all some really practical, simple, proven tools that can help reduce stress. All right, so 2-to-1 breathing exercise. You breathe in through your nose, we hold it, and then we breathe out through the mouth. Okay, so whatever number we breathe in, we hold our breath for that number, and we exhale double the count. Okay, so I'll show that to you momentarily. The other breathing exercise we did was the belly breathing, which is basically I had people put their hand on their belly and we breathe in through the nose and we exaggerated the breath so that our belly kind of expanded. And as our belly expanded, our fingers kind of separated a little bit, just to notice how much our breath has really, been how much our belly has expanded from our deep belly breathing. Very important to do that. When we do belly breathing or the 2-to-1 breathing or any type of deep breathing, we bring the breath down to the belly, which activates the relaxation response. Okay, so we did also a mental, it's a body scan, which I do, like I guide you through a meditation. And we'll be doing that. And the one that I want to add is the progressive muscle relaxation, which is almost like a body scan, but in this particular exercise, we're basically localizing certain muscle groups. We tense it up, we hold it, and then we release it. All right, so before I end the slide, next week, I will be back for more skills to share with you. So it'll be at 10 o'clock as well. So same Zoom invites to use. So I want to go off the slide share. And so that if you have any questions, you could put it on the chat or you can unmute yourself and I can answer your questions. All right. Yay. Okay, great. All right. So for those of you who want a copy of the slides, I will be giving it to Clayton. I know somebody asked last week. about the slide, a copy of the slide. So I will be sending week 2, all the weeks PowerPoint slides to Clayton. So that way you can download it or you can look at it again at your leisure. All right, so for now, we're going to do we'll start with a 2-to-1 breathing exercise. I'm going to move away from my desk so you can really see me. All right, and for this particular exercise, we're going to breathe in through the nose, and we'll start with a count of 3. So we breathe in for 3. I'll count for you. You hold for 3, and you exhale out for 6. Okay, and we'll do that 3 to 4 times. Okay, so let's begin. So we breathe in through the nose. 1, 2, 3. Hold for 3. 1, 2, 3. Out for 6. 1, 2, 3, 4, 5, 6. Okay, so catch your breath a little bit and let's start another one. So breathe in for 3. 1, 2, 3. Hold for 3. 1, 2, 3. And then out for 6. 1, 2, 3, 4, 5, 6. And let's repeat that one more time. And as we're doing these exercises, I invite you to tune in to your body. Notice if you like it. Notice if you're finding if your body is starting to relax. Notice when your body, as we're doing it, is doing one of these, a sigh. Because when you do that, that means your body's is expressing that it loves it. All right, so let's do one more 2-to-1 breathing exercise. So breathe in for 3. 1, 2, 3. Hold. 1, 2, 3. Out for 6. 1, 2, 3, 4, 5, 6. All right. Now, the other exercise I mentioned to you is the belly breathing. So even more, I'm going to move away from the camera so that way you can see. I'll put my ID back there. I'm going to put my hands, my middle finger will be on my belly resting. Okay, and I invite you to do that just so that it reminds you to bring the breath down. And we're going to breathe into the nose. And as you breathe into the nose, you'll notice your belly expanding. And when your belly expands, the tip of your fingertips, especially the middle ones, should separate. And when you exhale, you're flattening your belly and the fingertips should touch again. Okay, so let's do that again. Breathing in. Noticing how your fingertips are separated. And breathe out. Hopefully you can notice that your fingertips are touching. And again. One more. All right. Whew. I like that one. All right, now we're going to do the body scan exercise, and we'll do it for about 5 minutes. And what I'm going to invite you to do is just sit comfortably in your chair. If you have your legs crossed, if you can, please uncross them. Put your hands on your lap, and it doesn't matter if your hands are down or up, just nice and comfortable on your lap. And then just so that you're less likely to get distracted, I invite you to close your eyes. If you can't close your eyes, just look down at your feet. So that way, again, you're less likely to get distracted. And I'll begin. I'm going to direct you to your nose, taking a deep breath in through the nose, nice and slowly, noticing the cool breath as it enters your nose, and then breathing out. Again, breathing into the nose, noticing the coolness of the breath as it enters your nose. And breathing out. And that could be through your nose or through your mouth, whichever way you're comfortable doing. Again, breathing into the nose and out through the mouth. And then noticing the top of your head, just mentally noticing, scanning, focusing on the very top of your head, just noticing the top of your head, noticing how it feels right now. And then going down to your ears, listening for sounds in the room, listening for as many sounds you could hear. Then moving down to the chest, noticing the rise and fall of the chest with each deep breaths. And then going down to your elbows, noticing your elbows, noticing how both elbows feel. Then going down to your fingers, all 10 fingers, noticing all 10 fingers all at once. Noticing how they feel. Noticing how the palms of your hands are feeling. How do they feel? Just the palms of the hands. And then moving over to your low back, noticing your low back. Noticing if that part of your back, the low back, is touching the back of your chair. If so, noticing how the back of the chair feels. If not, just noticing the low back. And then noticing your right knee. Bring your awareness down to your right knee. And then your left knee, noticing your left knee. And then moving down to your feet, both feet, noticing both feet. And if you're wearing socks and shoes, noticing how your feet feels inside the socks, the shoes. Or if you're barefooted, just noticing how your feet feels against the ground. Now going back to the face, noticing the face, noticing how does your face feel today? Is there any tension there? Then moving over to the tip of the nose, the very tip of that nose, noticing the nose. And then going back to the breath, noticing as you take nice, slow, deep breaths through your nose, noticing the coolness of that breath. And breathing out through the mouth. Again, into the nose, out through the mouth. One more time, into the nose, out through the mouth. And slowly wiggle your toes, wiggle your fingers, open your eyes if they've been closed. Slowly come back to the room. Noticing how you feel. Did you like that? The body scan? Yeah, yeah. I'm just seeing nods. Yay. I like that too. All right, so one more exercise we will do. One more exercise. Let me just take a little sip. All right. So this one is called progressive muscle relaxation. And because I'm a nurse and we in the medical industry, we do a lot of abbreviation. Sometimes I call it PMR, progressive muscle relaxation. And what this does, it's almost like the body scan, but it's not. So what I'll do is you listen to the sound of my voice. I'll instruct you on different parts of the body to contract, to kind of go like this. And then you hold a little bit and then release, okay? So we just basically contract, hold, release. And what happens when we do that is those particular muscle groups, when we pay attention to them and we contract them, hold it, and release, we're allowing them to kind of move a little bit and be able to release any tension. And it's a wonderful, wonderful practice. Okay, so let's begin. We'll start this time, instead of the head, we'll start at the feet. So again, sitting up. And what we'll do is I'm going to ask you, and you don't have to keep your eyes closed for this one. All right, so with your feet, if you can, curl up your toes, curl up your toes, both feet as much as you can. Curl, 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 and release. Okay, so again, let's try that again. So both feet, try to curl up your toes as much as you can. So ready, 1, 2, 3, curl them both feet, curl up your toes as much as you can. Curl, 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 curl it up and release. All right, so now for the thighs, if you can, try to squeeze your thighs if you can. Okay, I'll give you a second to try to like localize your thigh muscles, so you could really kind of like make it go up and down. If your hands are on your thighs, just see if you could kind of contract and release your thigh muscles. Okay, because that's what we're going to be working on. So right now, I'm going to ask you to focus on your thigh muscles, which is your quadriceps. All right, I'm going to ask you to contract it. So contract it, make it tight, 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 and release. Okay, so again, focusing on the quadriceps, the thigh muscle. So tighten it up, tight, 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 and release. One more time. Tighten it, tight, 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 the thigh muscles, and release. Good. Now we're going to work ourselves up to the buttocks, the bum. Okay, so you see how we're progressing up the body. All right, that's why they call it progressive muscle relaxation. All right, so now I'm going to ask you to squeeze your butt, squeeze your buttocks. And then after you're squeezing it, hold it, and then we release. Okay, so ready? Squeeze your buttocks. Squeeze your buttocks muscles as much as you can. Squeeze, 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 and release. Okay, we'll do that 2 more times. All right, so again, your buttocks, squeeze, 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 and release. One more time. Squeeze the buttocks muscles, squeeze, 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 and release. Good job. All right, now the stomach. Okay, so I'm going to ask you to imagine as though you're tucking in your belly so much that your belly button is touching the back of your spine. All right, so tuck in your stomach, tuck, 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 and release. Whew. All right, we'll do that 2 more times. Again, tuck in that stomach, tuck in, tuck, 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 and release. One more. So tuck in that belly, tuck, 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 tuck. Good, and release. Good job. Good job. All right, so we're going to do the shoulders. The shoulders will go up to the ears as much as it can. So both at the same time. So just like this. Up, 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 and release. Just release. Just imagine all the weight of the world are on the shoulders, and as you're releasing, you're just letting it roll off because you don't need it. So again, raise the shoulder up to the ears, up, 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 and release. Just let all that stress and tension go. All right, one more time. Up, up, up with the shoulders, up, 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 up. release. All right. So we'll do the hands, okay? So the hands, we're going to make a tight fist, okay? So to make a tight fist, tight, 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 and release, okay? All right, so let's do that 2 more times. So make a tight fist, tight, 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 and release. Good. Okay, 1 more time. Tight, 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 and release. Good job. All right. Now we're going to do the face. The face is also good because we carry a lot of tension on our face, our forehead, around the eyes, the cheeks, the jaws. We don't even know that until it starts really getting inflamed or something is really, really bad. So right now, I invite you to kind of like touch your face. I know you're in your own home, so it's okay to do that. So find any areas of tension there just to kind of show to you that our face actually has like certain areas of tension, like the jaw sometimes, the cheeks, around here, around the eyes, or sometimes the forehead. All right, so it's always good to also include that when we are doing any type of relaxation exercises. It helps lessens the wrinkles. And all right, so we're going to, it's not going to look pretty, but you know what? Who cares? It's going to help reduce the tension on our face, and also in doing so will help really make it much more relaxed. So we're going to make like a pucker, like a face pucker look like this, and we're going to squint our eyes like this because we're going to tighten around that area, and we're going to just kind of like do one of these and maybe smile. Bring that smile all the way up to the eyes if you can, and release. All right. All right, so we're going to do that 2 more times. All right, so again, we're not going to look the prettiest, but who cares? In doing so, our face will benefit and hopefully lessens the lines on the face. All right, so again, we're going to squint the eyes, squint and smile. Okay, so we're tensing the face and release. 1 more time. Okay, 1 more time. So tighten the eyes, squint, squint, squint the eyes and smile. Nice and tight and release. I like that. Did you like that? That felt good. All right. So let's try to contract the whole body. All right. We'll try to do the whole body all at once. And we'll do that 3 times. Okay. So basically, you're going to curl up your toes. I'll tell you what to contract, but we're basically at the same time, if we can, contract the body as we can. Okay. So right, you ready? You ready? All right. So ready? Take a, just follow my instruction here. So curl up your toes. All right. Tighten the thighs at the same time. Tuck in the belly. Raise the shoulders up. Make a fist. Make that squinting face look and smile. Tighten the whole body. Contract the whole body. And relax the whole body. Relax. Relax all of it. Relax all of it. Do that 2 more times. All right, so again, we're going to start. So we'll start at the feet. Curl up your toes, tighten the thighs, tuck in the belly. This time, squeeze the buttocks, raise the shoulders up, tighten the fist, squint your eyes, and nice big smile, and just contract your whole body as much as you can. Tight, 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 and release. As you release, imagine all the tension, all the stress that you've been carrying around, just being washed away, just rolling off your body. Okay, 1 more time. 1 more time. All right, you ready? Here we go. Tighten the toes, the thighs, tuck in the belly, squeeze the butt. Make a fist, shoulders up to the ears, squint the eyes, smile, 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 smile. Tight, 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 and release. Release and let it go. Woo. Good job, everybody. All right, very good. Did you like that progressive muscle relaxation? Give me a thumbs up if you liked it. Yeah, yep. I'm seeing people nodding. Yep, 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 yep. All right. Okay, so does anybody have any questions? If you do, I can unmute you, or you could type in the text. Anybody have any questions for me? Did you enjoy today's program? Yes. Okay, good, good, good. All right. So I hope to cover more next week. So please come back again next week. If you have friends who you think might enjoy, have them come also. So I want to thank you. I want to thank you for being here. And also, again, Quincy Public Library. My name is Debbie, and I'm the Injury Prevention Coordinator at Tufts Medical Center. So I'll see you next week. Enjoy the week.
Bye, Debbie. Thank you.
Thank you, Clayton.
Take
Bye.
care.